Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, there are currently 3,908 cases of COVID-19 in 91 counties. There have been 77 fatalities in North Carolina associated with COVID-19. Currently, the state is reporting 423 hospitalizations across the state from COVID-19 illness. To date, Dare County has reported 13 positive test results for COVID-19. Of the 13 individuals who have tested positive, 8 have recovered or are asymptomatically cleared, meaning they are 7 days post-testing with no symptoms. 3 are asymptomatic, meaning they have not experienced any COVID-19 symptoms. 1 is recovering at home, and 1 died. As we begin the third weekend with stay home, stay healthy measures in place, it is important to continue to emphasize the guidelines that are in place for slowing the spread of the virus. Restrict all non-essential movement. Only go out when necessary. Avoid direct contact other than immediate family members, and practice good hygiene. This information may seem repetitive, but it is critical in our fight against the spread of COVID-19. On Wednesday, we provided information on emergency planning and surge preparedness. Today, I would like to take the opportunity to walk through a very useful tool that provides some great information on the scope of COVID-19 impacts in North Carolina. North Carolina DHHS has set up the COVID-19 North Carolina dashboard. It is available at www.ncdhhs.gov. This site is updated once daily by the state. On the main page, the state provides the number of positive, lab-confirmed cases, the total number of deaths in North Carolina, and the number of tests completed. Please note the number of tests reported may not be all-inclusive, as commercial labs are not required to report the number of tests performed, only positive results. Also on this page are the number of individuals currently hospitalized in North Carolina for COVID-19 related illnesses, and the number of North Carolina counties reporting positive cases. If you scroll down the page, you find a number of tabs. The County Map tab provides a graphical representation of where cases are in North Carolina. The By Counties tab provides a list of counties and the number of reported cases per county. You will find this number for Dare County may be different from what is reported on the Dare County website. The state number reflects only those cases with identification that listed a Dare County address. The Dare County figure reflects the total number of cases reported to Dare County, not just those with a Dare County address. The Age tab shows the age breakdown of the total number of North Carolina cases and fatalities. You may also find this number to vary between what the state reports and what Dare County reports. This variance is also related to the physical address on the individual's identification. Additionally, at the local level, we will report data as soon as it is available, whereas the state may have a day or two delay based on the filing of death reports. The Race Ethnicity tab shows the race breakdown by number count and percentages for the North Carolina confirmed cases and deaths. The Gender tab shows the breakdown of cases and deaths by gender. The Cases Over Time tab shows the number of new COVID-19 cases each day based on when the individual specimen was collected. The By Reporting Hospital tab shows the inpatient hospital bed count. This is a valuable metric related to surge planning, as it provides a snapshot of how many empty beds are available in North Carolina and the type of bed, inpatient or ICU bed. Also under this tab, you can see the number of patients on a ventilator, not specific to COVID-19, as self-reported by hospitals, as well as the total number of ventilators available. Again, this is a useful tool in surge and resource planning. The PPE, or Personal Protective Equipment tab, reflects the type of PPE requested from the Strategic National Stockpile and what has been distributed to the agencies across the state that have made PPE requests. The Congregate Living tab shows the COVID-19 outbreaks by congregate living type and includes counties where the facilities are located. This is another metric where you may find a delay in the state's report. Again, we are sharing information locally as soon as it is available, and the state updates their data daily based on reports filed with the state. In yesterday's update, I did not include the Public Health Awareness Week message. Today, I will cover two topics: environmental health and education. If there was ever a silver lining regarding COVID-19, now would be a good time to find it. Perhaps we have found it regarding our environment and air pollution. The actions taken across the globe to stop the spread of COVID-19 has led to a decrease in air pollution. Try these things to help reduce your footprint. Use this time to get exercise and help the planet. Take a walk on the beach or in your neighborhood and pick up trash. Be sure to stay 6 feet away from others and practice good hygiene. Reduce the number of trips you take in your car. Instead of leaving the house multiple times a day or multiple days in a row, make a list of everything you need. Take an afternoon or weekend day to run all of your errands at once. As your light bulbs burn out, replace them with energy-efficient bulbs that reduce greenhouse gas emissions. Conserve, conserve, conserve. Use less water. Turn off the lights when you leave the room. Buy less plastic. On the education front, we have been fortunate enough for our students in Dare County to be able to continue their education at home during the COVID-19 outbreak. Thank you to Dare County Schools leadership, teachers, and staff for their extraordinary efforts to make virtual learning a reality. Adjusting to this dramatic change in routine and life disruption has been challenging for many students, teachers, and parents. With sports and after-school activities no longer in the picture, a hiatus from meaningful activities interrupts daily routines and may result in feelings of sadness and boredom. Here are some ways you can fill that time. Learn a new language with your kid. Rosetta Stone is offering a free 3-month subscription service right now. Babbel just opened up 3 months of free classes in 12 languages. Take a virtual field trip. During this time, many organizations around the world, such as museums and aquariums, have begun offering free virtual tours. Take advantage of this. Cook or bake together. Cooking and baking can be a great math lesson in measuring and provide the opportunity for some help with making your dinner or dessert. Let your young people express themselves through arts and crafts. Make pasta jewelry. Draw in your driveway with sidewalk chalk. Make your own hand soap. Choose an activity that will be fun for you and them to do together. As we move forward through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 call center at 252-475-5008. Thank you.